pandemic, and we are now entering into a stage of routine prevention and control. Today we have with us Mr. Zheng Yixin, Deputy Minister of National Health Commission. Mr. Zheng is going to give us some introduction about the routine control and prevention of epidemic. At today's press release, we have also Secondary Inspector Mr. Cui Gang from the National Health Commission, and Madam Guo Yanhong, Ombudsman from the National Health Commission, and Mr. Li Mingzhu, a Policy Ombudsman from the National Health Commission. Now let's give the floor to Mr. Zheng. Dear friends from the media, good afternoon. Since the outbreak of the coronavirus epidemic, the CPC Central Committee, with President Xi Jinping at its core, led the nation in a fight against this epidemic, and we have secured a basic victory. Recently, President Xi Jinping has chaired a number of Politburo meetings at the central level to improve our measures for routine prevention and control of the epidemic. So we have to stop the virus from coming in and contain the spread of the disease here domestically. And after a number of months, we have already secured some basic victory, and this laid a solid foundation for the sustained recovery of our economy. On May the 14th, which is yesterday, President Xi Jinping chaired a Politburo meeting to research into the execution of the policies of routine prevention and control. He said that we can never afford to see that the previous efforts are now being vain. And the fundamental goal is to build a society, build a well-off society. And to that end, the CDC of China also worked out a work plan to orderly promote the resumption of industrial operation. When epidemic prevention and control becomes a routine action, we have to effectively promote the reopening of factories, enterprises, and schools. And the Joint Prevention and Control Mechanism of the State Council also published a guiding opinion on this effort, which highlights critical links and the strengthening of leadership and organization. Another work plan is released to minimize the risk of hospital-related infections, and also to execute the policies of reopening enterprises and factories. We also worked out a technical guideline for middle schools and primary schools to reopen, and the government at different levels have to execute this policy in a very strict manner. In the meantime, we have launched global cooperation to share with the world about the experience and practice here in China, and we provided necessary assistance and technical support to a lot of countries. And only in the past week, the National Health Commission has conducted collaboration with Central and Eastern European countries and launched telephone conferences with the health ministers in France, in Germany, and in many Western countries. We also dispatched many medical expert teams to support those countries fighting coronavirus. And right now, the global pandemic control efforts are well underway, and we are in a process of economic recovery. But we must also be mindful that in general, there is some scattered cases now and then, and the pressure on our shoulders is still quite mounting, and you must have also noticed that in Heilongjiang and in China's northeastern part, there is some new cases, and outside the country, the situation remains very challenging, and there is increased pressure of imported cases from overseas, and the overall trend is not very clear and explicit. So we have to be mindful about the potential risks of the importing cases from overseas, and also here domestically containing the spread of disease. So we have to make the prevention and control of epidemic a routine action. And in the next step, we are going to further follow through the work plans made by the State Council and CPC Central Committee in terms of routine prevention and control. We have to enable early discovery, early isolation, and effective treatment. In this mechanism, we have to focus on key areas and key places. We have to continue to do a good job in helping enterprises and public places, including schools and kindergartens, to follow through relevant regulations, and also they need to, every one of us need to better protect ourselves, and we need to work out plans to help schools to reopen so that we can ensure the safety and health of teachers as well as students. For Hubei and Wuhan, the action has transformed from emergent response to routine actions, and we have to continue to do a good job in testing, and in Heilongjiang and in Jilin, in places where there are some new cases, we have to act very swiftly to identify the source of the virus, and very quickly we need to contain the spread of the disease so that we can better prepare for the upcoming 2 sessions of the year, and relevant parts, they need to be better prepared in terms of testing, and through all these measures we are able to guarantee the life and health, life security and health of the population, and lay a good foundation for reopening of factories and schools. And that's my brief opening remark. Thank you very much. Now the floor is open for questions. I'm with China Central Television, and my question is that Wuhan right now is conducting a citywide testing for the whole population, and also the State Council Joint Prevention and Control Mechanism has released a guiding opinion on routine prevention and control of the disease. And in that document, there is this policy of voluntary testing. So how do you address those specifics? Well, let me answer your question. Wuhan recently has launched a citywide testing effort covering all the population in a city. The purpose is to further identify the scope of the virus so that we can know for how large an area that the virus is affecting. And this is a very important measure, and this is also very important for us to ensure routine prevention and control, and to facilitate the reopening of schools and factories. On the basis of scientific testing, expanding the scope of testing will be able to ensure health, security, and safety, and also to normalize the social and work order. And we're not talking about just Wuhan, and different cities can adjust and can optimize this routine prevention and control efforts, because different regions and they have different realities, and they can slightly adjust their testing strategy and also the testing scope. For Wuhan, it's covering the whole population in terms of testing, and this is a very arduous task in terms of organization, in terms of social mobilizing, and we have to ensure which population goes first, what is the gap between the first batch of people tested and the second batch. We have to place a curve of close contact between those two different batches of people tested. And technically, we have to collate all the samples, and we have to improve the accuracy of the testing. And these are very arduous tasks. On May the 7th, the Joint Prevention and Control Mechanism at the State Council released a guiding opinion on routine prevention and control of epidemic, which put forward specific and very feasible methods and measures. In order to further execute this guiding opinion, we have to actively expand the scope of testing and minimize the risk of spread, and different localities can dynamically adjust the scope of testing and the testing method. And for key groups of people, they have to be tested, and for other groups of people, the test has to be conducted in a voluntary manner. And secondly, we need to increase the capacity of testing centers and facilities, and we also need to mobilize third-party privately owned testing centers, and we need to step up research in testing kits. And in the meantime, the production capacity of test kits and test facilities have to be improved. And we have already approved a lot of facilities and test kits, but in this process, these products can be further optimized, and there's still a lot we can do in this aspect. And thirdly, we need to improve our work mechanism and improve the efficiency of the testing. And the accountability system must be put in place to guarantee that all stakeholders shoulder up their responsibilities. And we also need to win the support and cooperation of the population, and so that they are willing to collaborate with us in submitting their samples. And because this is an effort that is hinging upon the collaboration and understanding of the population. And fourthly, we need to strengthen the level of support, and different governments and authorities need to be aware that this is a routine prevention and control measure. They need to improve their capacity in testing and execute these efforts so as to lay a solid foundation for avoiding the bouncing of the cases. Thank you very much. I'm with Tas from Russia. Since the outbreak, how do you comment on the collaboration between China and World Health Organization? And China has facilitated the trip of the WHO to the P4 lab in Wuhan. Is that authentic? Or may I give the floor to our colleague from the International Collaboration Division of the National Health Commission. Thank you very much for your question. And right now, the pandemic is still spreading overseas, and China faces a very arduous task in containing the spread of the virus. And while doing a very good job here domestically, we are also engaged in international collaboration at the multilateral level. We are working together with G20 and also the WHO to consolidate and execute the collaboration initiatives put forward by those two organizations. And we have just concluded the video conference of health ministers between China and CEEC, and between China and Japan, and China and Korea. Similar video conferences were also held. And technically, China had conducted a video conference with 12 African countries to exchange the technical side of experience with those countries. And also, at the request of relevant countries, we have dispatched 21 medical expert team to 19 countries to help those countries to launch a campaign and fight against the pandemic, and their efforts have been fully supported by the local population. The World Health Organization is one professional organization under the United Nations, and it plays a very important leading role in coordinating the global health efforts, and that is why we attach great importance to our collaboration with WHO, and we also staunchly support the leading role played by WHO in global pandemic control. And since the epidemic, we have been adhering to the principle of transparency, responsibility, and openness. We have been sharing information related to the coronavirus. And we also established a technical exchange mechanism with the WHO, and we have conducted many rounds of meetings. And we also invite the WHO experts to come to China. And on January the 20th and 21st, we received the expert team from WHO on a field visit to Wuhan, and the expert team visited some medical institutions, and including some of the labs, and they conducted very in-depth exchange with the experts in Wuhan, and between February the 16th and 24th, and we received the visit of a joint medical expert team from the WHO. They visited Beijing, Sichuan, as well as Wuhan, and they conducted a very thorough investigation on the medical response and also the scientific research related to pandemic control. And they put forward some of the very valuable proposals to experts in China, and the WHO has never put forward a request of visiting any particular lab. So what you just said about China denying the visit of the P4 lab is not true. I'm with Cross Street Daily from Singapore.
I have two questions. The first question is, can you please comment on two specific allegations made by U.S. State Secretary Mike Pompeo that the National Health Commission had ordered virus samples destroyed on January the 3rd, and that China had not shared virus samples with other countries? My second question is, why does the NHC insist on not including asymptomatic cases in its official tally when such cases are proven to be infectious and clearly a cause for concern? Thank you. 谢谢。
您好，我是新加坡海峡时报的记者。我想请问您，美国国务卿蓬佩奥表示，中国卫健委在1月3日下令销毁病毒样本，并且拒绝和其他国家分享病毒毒株。您对此有何评论？能否证实？另外，卫健委为何坚持不把无症状感染者纳入官方统计？考虑到现在无症状感染者确认是有感染能力的，并且引起很多关切，您如何评价？谢谢。
May I give the floor to Liu Dengfeng to address this question? American officials are disseminating those misinformation, and they are spreading rumors since the outbreak. And since the outbreak, as you know, that this is a unknown virus, and we have to launch a scientific research on this kind of virus, and we immediately proposed that experts should conduct immediate researches, and they very quickly identified the sample of the virus. And in the meantime, we attach great importance to these efforts, and we organized a lot of experts to engage in these efforts, and we also ensure biological safety in these aspects. And according to the proposals of some of the experts, we and decided to manage this type of virus samples as a category B virus, and we also, out of the consideration of biological safety, ordered some of the labs to destroy these samples. On January the 3rd, we published this document, and the purpose has been very clear, and this is simply to guard against the potential risks in biological accidents. In the meantime, in order to improve the safety of biological labs, and during the epidemic, we have released 2 guiding books for biosafety, and these 2 guiding books have played a very important role, and for a very long period of time, and China has a very strict procedure and management for biosafety in labs, and for labs who are not equipped with the conditions to store and manage the virus, and they need to be closed. And this is an effort according to law, and this is also a requirement of the Chinese regulatory authority on those labs. So this is about the first part of your question, and this is the fact regarding the order to destroy some of the samples. With respect to the sharing of the various samples, China has been open in this aspect from the very beginning, and we have been very active in sharing the samples. For example, in recent years, in order to avoid a global pandemic of influenza, we are sharing samples with the United States, Great Britain, Japan, and Australia, and we offered some of the best influenza samples with those countries. And the same attitude is applied for this coronavirus pandemic, and we are sharing the samples of coronavirus with relevant countries, and we also support the development and research of vaccines for the coronavirus. So this is my response to your question. Thank you. Well, let me quickly add a few words about asymptomatic cases. The National Health Commission has looked into this particular issue, and for 3 considerations that we decided not to include that in the tally, because number 1, there are 2 groups of people that are asymptomatic cases. The first is those patients that have shown no symptoms or mild symptoms for the whole process of the infection. And for the second group of people, the virus may be in the body, but it's in a latent mode, and on a later stage, there might be symptoms. So if you categorize them as a confirmed case, it's not very reasonable. And if you categorize them into suspected cases, and then it's also not reasonable. So this is a decision made out of the perspective of management. And that's reason number 1. And number 2, for asymptomatic cases, you may have taken note of that each and every day we report not just confirmed cases, suspected cases, but also we have a particular column of our tally about asymptomatic cases. And we also disclose to the public that how many asymptomatic cases are transforming into confirmed cases every day. So we disclose the information in a very comprehensive manner, and there is no gap. Number 3, asymptomatic cases, confirmed cases, and suspected cases are being treated equally, and we have a very strict set of procedures and medical treatment protocols for those different cases, and we have been following many different types of cases very closely, and we have in place a very strict set of procedures to manage different types of patients. So it is because of these considerations that we decided not to include the asymptomatic cases as a confirmed case. Next question, please. I'm with Bloomberg. Some reports say that on January the 14th, the National Health Commission already predicted that there would be a pandemic. But 6 days later, on January the 20th, it was only on January the 20th that China said publicly that there is human-to-human transmission. So what is your comment on this? And some American officials say that China did not immediately share the related data and material of the coronavirus, and what is your comment and response to that? Thank you very much for your question. So I have to make a statement for this question. Human-to-human transmission. So this is a plain way of seeing that, and if we use technical terms, it is the transmission capacity and way of transmission between humans. And that is the professional way of calling that. Why do I make such a distinction? Because in theory, no matter it is a bacteria or a virus, there is human-to-human transmission, no matter if you're talking about a virus or a bacteria. So there is human-to-human transmission no matter what you're talking about. And there is the possibility of human-to-human transmission for both bacteria and virus. The only difference is that the transmission strength or capacity is not exactly the same. Some of the virus can be transmitted very easily, and to give you one example, we have one for example, the novel virus that can be transmitted between human beings as well, but the transmission is not very strong. For example, AIDS is also caused by a virus, and it also has a human-to-human transmission. But you have to have sexual intercourses with the person infected, so it has a lower level or lower capacity of transmission. So I'm saying that most of the diseases can be transmitted between human beings, and the only difference lies in for how easy the virus can be transmitted. And when the epidemic was just identified, we were not quite sure about how strong the virus is and how it transmits. So that is why the National Health Commission organized several different batches of experts to conduct a visit to Wuhan, and we immediately conducted a epidemiological research and study about the coronavirus, and our goals were exactly to answer those questions so that we can offer a scientific reference to the decision-making of the country. And on the evening of December 31st, we were informed that there is a new type of virus in Wuhan. So we attach great importance to this question. And then, on the night of December 30th, we were informed. And then on the morning of December 31st, we immediately sent out experts there. And on the morning of January the 1st, the National Health Commission set up a leading team and task force on this coronavirus. And we also sent some leading experts to guide the epidemic control in Wuhan. On January the 3rd, which is the 4th day on our calendar, we organized relevant scientific institutions to conduct a parallel testing over the disease, which means that we are doing many different tests in parallel so that we can verify the result of different tests. And on January the 5th, we know that it's not SARS, it's not swine flu, and it's not influenza. On January the 7th, the CDC successfully isolated the seed of the virus. On January the 9th, a team of the experts first identified this virus as a novel coronavirus. On January the 10th, we were successful in developing a test kit, and then the next couple of days we optimized the test kits, and we call on all the medical workers in Wuhan to actively isolate these kind of patients. And the next day we shared information to the WHO so that more countries can be able to diagnose this virus. And we also sounded the alarm at the global stage. On January the 13th, there was this first imported case in Thailand from Wuhan. And we paid close attention to this question. And so we have straightened the management of the seafood markets, and also we placed very strict measures at the different ports and airports. We take the temperature of passengers, and also we disallow public gathering. And in the meantime, we ask different localities to report patients with symptoms, and we also popularized knowledge. On January the 14th, our commission organized a nationwide TV conference meeting to brief the country in this particular field. And we said that the way of transmission is not very clear, and how it transmits between human beings and maybe other animals is not very clear. And the possibility remains there, and we also put forward very explicit requirements on the Wuhan authority. And you talked about January the 14th, and when we were conducting the meeting on January the 14th, and we were still at a very preliminary stage of understanding about the virus. And at that point of time, we were not able to give any conclusive opinions or knowledge. And there is a lot that we still didn't know. And on January the 19th, after a couple of medical experts' visits, and after careful study and investigation over the virus, and then on the next day, which is January the 20th, the Executive Conference of the State Council decided to include the novel coronavirus as a national infectious disease, national level infectious disease. And now, in retrospect, in hindsight, we know that this is the first time that human beings are dealing with such a pandemic disease. And under the leadership of the State Council, we were able to identify the disease within a very short span of time. We were able to understand this new type of virus very quickly. And in the meantime, we held a bottom line mindset, and we always put in the first place people's health and safety. And we scientifically worked out a epidemic control mechanism. So this is simply my answer to your question regarding our judgment on January the 14th. And at that point of time, we still didn't have some very tangible, conclusive ideas. And you also talked about the statement of U.S. officials, and my colleague earlier has just responded. And our communication with the United States actually took place in a very early date, and we were also in close collaboration and exchanges with the U.S. There are ministerial level of exchanges, and also between experts and scholars and between research institutions, and we were not covering anything up. We were not delaying a single minute, and we exchanged information immediately so that we can promote the knowledge sharing between the two countries and support the global fight of the coronavirus. Thank you very much. The pandemic at the global level is still spreading, but European and American countries are loosening their control measures, and here domestically in some localities, cases are reappearing, and everybody's worrying about the bouncing back of the cases. And are there any response measures from the National Health Commission in China? May I now give the floor to Shao Gang for him to give you a response. At the very beginning, Deputy Minister Zheng Yixin have actually briefed you about the pandemic control situation here domestically and also globally. And from the media reports, everybody knows that what the situation is here in China and at the global level. So to put it in general, the situation is still very challenging and sophisticated. The different countries are taking into consideration their social systems, their economic performance, the intentions of their population, and their capacity of emergent handling. Different countries, they have taken different formats of responses, and you talked about the European countries and the U.S. are reopening their economy despite of the ravaging pandemic. At a time when the world still doesn't have a vaccine or a effective medicine or drug, if we loosen or relax control, then the most direct consequence is a rebound of the epidemic. In the meantime, it will make the situation even more challenging and sophisticated. And it will also make it harder for China to contain the epidemic. With our efforts from the past few months, China has basically claimed a victory over the epidemic. We anticipate we are much better in anticipating the trend of the disease, and we have trained a huge number of medical doctors. We accumulated very feasible and effective experience and solutions, and the public has been well educated, and now they have better awareness in epidemic control. And with the execution of the policies and measures introduced here in China, I believe that the risk of a bounce back here in China because of imported cases overseas is controllable. And recently in some localities in China, there are some imported cases. And this is constantly reminding us that at a time of global pandemic, at a time of global efforts against pandemic, if any single link break loose, there will be some risks and consequences. According to the policies of the CPC Central Committee and the State Council, the different authorities and different levels of governments have to carefully screen potential risks in order to prevent the disease. We have a seamless connection and coordination between different parts and different places, and let me outline some of the measures. Number one, we strengthen joint prevention and control. The National Health Commission is working together with China's Foreign Affairs Ministry, Custom Clearance, Civil Aviation, China Railway Corporation, and many others to practice joint prevention and control so that we can further improve some of the existing measures to prevent the disease. And for example, we have in place a 14-day collective isolation for those who return to China from overseas. Number two, we focus on the key links, and we have in place a measure of 4 early identification, early isolation, early treatment, and early recovery. We have a link between fever clinics and disease monitoring, and we have a closed-loop comprehensive management in place. In the meantime, we have expanded the scope of testing, and a while back, Mr. Zheng gave you a comprehensive update on this. And number three, we have in place precise control, and we scientifically define the scope of prevention and control, and where there is a new case, we would very quickly take the most effective measures to handle the situation so that we can immediately track the source of the infection and very effectively identify the roots of the transmission. And number four, we have in place a accountability system. Different stakeholders, such as the government, the enterprise, and the sub-district, and as well as individuals, they have to shoulder up their responsibilities so that all the different types of measures can be truly practiced with no dead corners, and in the meantime, with no loopholes unattended to. And in the meantime, we do a very good awareness campaign so that we can jointly promote and build an atmosphere where everybody gets involved in epidemic control. Thank you very much, Hong Kong Economic Daily. Since the epidemic, China has taken a number of very strong measures. Right now, the pandemic is still spreading overseas, and what are the experiences that we have that can be shared with the world? Thank you very much. For medical treatment, we aim at improving the admission rates and the treatment rates, and we also have in place a 4 early and 4 collective principle. And to give you a summary, we have the following experience. Number one, we bring everything early. We have early identification, early diagnosis, and early isolation. And we also do a very good job in fever clinics, and we extended the number of fever clinics and also added the overall number of medical observation rooms. And we also isolate suspected cases and also improve the capacity of laboratories. And we mobilize qualified labs and third-party testing centers to provide testing so that we can improve the efficiency of testing so that we can diagnose, report, treat the patients as early as possible. Number two, we expand the availability of our medical resources, and at a time when confirmed cases are quickly increasing, in order to bring those patients to hospital, we mainly engaged in 3 areas of efforts. The first is to dramatically expand the medical beds in hospitals, and in Wuhan, within a very short period of time, we built WHOChina and Leishan Hospital. We also built those shelter hospitals. In the meantime, some of the very strong hospitals they were immediately transformed into the designated hospital to admit coronavirus patients. So within a very short period of time, we were able to provide 41,000 medical beds, and 9,100 medical beds are for people with severe symptoms. In the meantime, we very quickly dispatched a medical team, and within less than a month, from January to 24th, when we dispatched the first medical team, and within 1 month, nationwide, we have organized 42,000 medical doctors to on a rescue mission to Wuhan and Hubei province. And in the meantime, we allocated medical supplies and equipments through the expansion of these 3 types of medical resources. All the patients are admitted to hospital and given reasonable treatments. And number 3, our experience is that we have constantly optimized our treatment protocols. The protocol is very important in that it can summarize the practices at the clinical level. In the meantime, it can provide a lot of guidance and standardize the overall treatment process while improving our treatment protocol. We also rely on some of the latest discoveries in laboratories, and we have identified some of the very effective drugs. In the meantime, some of the very effective treatment strategies are included in the protocol, and that's why we have introduced altogether 7 different treatment protocols, and the 7th protocol is now translated into many different languages. Number 4, we collated resources and focused on people with severe symptoms. So we organized the best resources, the best doctors, the best medical supplies to focus on people with severe symptoms. And while treating people with severe symptoms, we focus on medical research and also clinical practice. And we also focus on a combination of medical treatments and hospital management and good nursing practices. And for example, we also embrace the combination between Chinese medicine and Western medicine. And we also attach great importance to the treatment of people with mild symptoms so that we can avoid the transformation from mild symptoms to severe symptoms. So we have a number of very good practices. Number 5, the experience is we have a full process covering treatment, and after the patient is discharged from a hospital, we have interviews, we have tracking and following, and so we have a out-of-hospital follow-up care, and this is also very important. The last 2 questions, please. With prevention and control measures becoming a routine behavior, everybody is concerned about the development of vaccine, and any updates on that? Well, everybody's asking about the vaccine, and since the outbreak, under the joint prevention and control mechanism, we have set up a scientific task force which is affiliated to China's Ministry of Science and Technology, and we have a team of scientists who are organizing the efforts of different scientific research institutions, and right now we are well underway. The smooth progress that we can achieve can be attributed to our advantage in terms of social system. We are able to mobilize different resources and coordinated the efforts of different stakeholders, for example, medical institutions, and we are able to retrieve the records from the medical institutions, and between medical institutions and research institutions there is very close collaboration. Scientific research institutions are also working together with the enterprises. And the government is also playing a very important role, and for every discovery, it has to be retested by a peer organization, and the collaboration and coordination between and with the government is also very important. And this includes the efforts of the Ministry of Science and Technology, which has approved a lot of new programs. These have laid a solid foundation for the smooth progress of scientific discovery. So this is fully reflecting China's advantage in political system. And right now, we have some active vaccines. We have 4 different types of active vaccines that have been approved by National Health Commission. Right now, they are in stage 1 and stage 2 clinical trials. And this is a innovation that we have just introduced because the approval stage has been shortened. As of the present, we have actually vaccinated more than 2,000 volunteers. And altogether, more than 5,000 volunteers have been vaccinated. And for stage 1 trial of the vaccine, we have vaccinated more than 1,000 volunteers. And some of the volunteers have shown a positive antibody, which indicates that the vaccines is safe and effective. And for the stage 2 vaccine, it has vaccinated 2,036 volunteers. And right now we are conducting a safety and effectiveness analysis to see that how many needles that you need to take to be vaccinated. And in the clinical trial period, so far we have not received any major side effects. I'm talking about the stage 1 and stage 2 trial clinics. If everything goes on well, these programs that I've just talked about, they will be able to complete the trial 2 clinical trials by the stage 2 trial clinics by July this year. And we also have some other technical roadmaps, and we have different task phases which are making smooth progress. And some of the programs ended up in the deadlock, and they found that their product is not working. And this is only normal. And when their product doesn't work, they quickly make adjustments. And they also submit another application to the National Authority for Medical Research and Clinical Trials. And we anticipate that by June there will be more programs approved by the National Health Commission, and they will enter a stage of clinical trial. So this is my response to your question. Thank you.